evening. My name is Cara Schmieder. I'm a licensed practical nurse, and I'm also certified as a healthcare practitioner to perform CPR. In this speech, I want to instruct and demonstrate the proper updated 2012 procedure for performing CPR on an adult person. I'm going to do this by explaining how CPR could save somebody's life, the rationale on what it does to the body, and demonstrate how to perform CPR. I want to share my knowledge with all of you in case you're ever in a position where someone's counting on you to take their next breath. I want to begin by explaining how you come to the decision of using CPR to save somebody's life. You first want to make sure that the person's in a safe environment and that they are truly unresponsive. And I'll explain later on how you would really determine if somebody's unresponsive. This is important because you don't want to cause any more harm than the person's already had. Also, I wanted to explain about the Good Samaritan Act that protects regular people as well as medical professionals from harm that may be created as you're trying to help somebody. When a person's heart stops or they become unable to breathe, CPR can help them by chest compressions, create circulation. When the heart's not able to beat, you can circulate the blood throughout the body instead of the heart doing it. You can help the person's body to do that. Now I'm going to explain step by step how to properly perform CPR. First, like I said, make sure that the patient or the person is in a safe and secure environment. You want to make sure that they're on their back, flat, and on a flat surface, as in this. And make sure that you get in the correct position. I'm level with the person here and they're at my waist. If this person was on the floor, I'd want to kneel down this way when my elbows are straight and I'm like this, then I can press down on the chest. Remember, that now that the person's flat on their back, the first thing you're going to do is look, listen, and feel. You want to look to see if the person's breathing, to see if their chest is moving up and down. If that's not working, then you want to listen. See if you can hear them breathing. If you can't hear them breathing, finally, you want to feel for the circulation. See if they have a pulse. Right here is a carotid pulse. You want to feel for about 5 to 10 seconds. If there's no pulse and the person's unresponsive, then now you know that you can start CPR. You're going to do your circulation, your airway, and then your breathing. CAB. Used to be the ABCs, but now it's CAB. So you start first with your chest compressions. You want to find the sternum, which is the bone right here under your ribs. Move up to the center of the chest, where the heart is. Because remember, you're promoting circulation throughout the body because the heart's not able to do it. So you find the patient's sternum, you move up to the center of the chest, interlace your fingers, put the ball of your palm down on the chest, and perform chest compressions at about 80 to 100 compressions per minute. So it would be pretty quick, actually. And you do that 30 times until you start your breathing. So you want to open up the airway, lift the head, tilt the chin, and you want to pinch off the nose and provide a good seal around the mouth and 2 breaths at about 1 second each. You don't want to overexpand the lungs, and you can see the chest come up when you provide your breath. Now, not everybody would have one of these laying around, but they are something simple that you could pick up at your local drugstore. And this you want to place into the person's mouth, and this is where you breathe. And now this helps too because the person's not going to be able to breathe back into you. But now you could hear if I breathe into them. So you, again, 1 second, so you just push that in there, and then that provides a good seal. And a 1 second breath, remember, don't overexpand the lungs. So now you're going to kind of go back to step 1, which is to look, listen, and feel. If they still don't see them breathing, they're still unresponsive, and they still have no pulse, and you don't hear them breathing, now you know to start again with your chest compressions. 30 to 2 is the ratio. 30 chest compressions, lift the head, tilt the chin up, provide a good seal, and then 2 1-second breaths. And then you want to do this until the emergency medical services arrive. to take over for you, or until another person or medically trained professional can come to take over for you. Now remember, if there's two people, you don't want to get too tired if you're going to alternate, but that's a little bit over as far as just this simple instruction. So now remember that after you get all done and someone's there to help the person, you can walk away, wash your hands and your face, make sure that now you don't come in contact with something that they may have been in contact with. So now that you've heard my speech, I hope that you feel a little bit comfortable knowing when, how, and why you want to perform CPR to help save someone's life. The American Heart Association says that 95% of cardiac patients die before they even get to the hospital. So somebody has a heart attack or stroke and nobody's there to help them. So now that this is all done, I hope that if you come in contact with an unresponsive person, you can save their life.